Assalamu alaikum. Raynaud's phenomenon. Raynaud's phenomenon is a problem that causes vasoconstriction of distal arteries and arterioles, which decreases blood flow to the fingers and toes. And in some cases, it also causes less blood flow to the ears, nipples, knees, and nose. This happens in response to cold or emotional stress. Primary Raynaud phenomenon, previously called Raynaud disease, is idiopathic, meaning we do not know the exact cause that lies behind it. While secondary Raynaud phenomenon, previously called Raynaud syndrome, is caused by underlying systemic diseases like mixed connective tissue diseases, especially scleroderma, and vasculitides. Raynaud's phenomenon may also be a result of some triggers like smoking and cold, or some medications that affect autonomic nervous system. The endothelium usually produces substances like nitric oxide to regulate the vessels and keep them dilated. In Raynaud phenomenon, there is a vascular abnormality in which the endothelium does not produce enough vasodilating substances. In this situation, the blood vessels spasm and blood flow reduce, which causes ischemia, and the digits appear white. Later on, when the hand warms or the trigger stops, the blood flows back to the area and it appears red. There is often an abnormality in the autonomic nervous system, so repeated periods happen during stress, where the norepinephrine in nerve endings are released, and they cause vasospasm in blood vessels. The fingers in Raynaud phenomenon discolorate in sequence from white, ischemic, to purple-blue, hypoxic, to red, hyperemic. In the ischemic phase, after the exposure to the trigger, the arteriole vasoconstricts and the skin appears white, ischemic, and paler. Then the tissue deoxygenases and hypoxic phase happens, and it appears blue, cyanuric. Later on, the blood flow is restored and reactive hyperemia happens, giving red appearance. These vasospastic episodes are usually reversible, and they subside within an hour. The Raynaud phenomenon most commonly affect fingers and toes bilaterally, but sometimes they may be asynchronous and asymmetric. Repeated Raynauds can damage the skin and cause ulcers. In secondary Raynaud phenomenon, the ischemia may be critical, so severe pain and ulcerations, necrosis may appear. At the hyperemic phase, the blood flow is increased and the fingers may swell, tingle, and become painful, and the patient may have trouble feeling them. The commonest form is the primary Raynaud phenomenon, and it can be prevented by staying in warm environments or keeping the digits warm. The patient must avoid the triggers, like stopping smoking and moving to a warm climate. The use of vasodilating drugs, like calcium channel blockers, may be helpful. In secondary Raynaud phenomenon, treatment of the underlying disease makes it better. That was all for Raynaud's phenomenon. Now let's make a quick review. Raynaud phenomenon is a vasoconstrictive response of distal arteries and arterioles to cold or stress. They cause the tissue to change white, blue, and then red once the vasoconstriction ends. They most commonly happen in fingers and toes. Primary Raynaud phenomenon is idiopathic, and it is called Raynaud disease, while secondary Raynaud phenomenon is caused by underlying systemic diseases, and it is called Raynaud syndrome. This concludes our discussion about the subject. If you want to test your knowledge by solving the questions, continue the video. We said that in secondary Raynaud phenomenon, treatment of the underlying illness makes it better. Remember, the Raynaud disease is the primary Raynaud's. At the hyperemic phase, the blood flow is increased and the fingers may swell, tingle, and become painful, and the patient may have trouble feeling them.